Hi and Assalamualaikum. My name is Nur Shazana and I will be the first presenter. Second presenter will be Wahida Mardiah and one of our group member is Dania Farhana, but she is not be able to be here today since she is warded. And for my part, I would like to present about introduction and string. The first article is Transference Focused Psychotherapy, TFP for Narcissistic Personality. Psychoanalysis is a collection of psychology theory and treatment approach that have been their root in Sigmund Freud works and theories. The aim of psychoanalysis therapy is to make the unconscious conscious by releasing repressed and feeling and experience. Several basic approaches are used is free association, use random word, and psychoanalytic studies have by far provide the most comprehensive description and understanding of narcissistic personality functioning. For second article is the relationship between reflective functioning and affect consciousness in patients with avoidant and borderline personality disorder. BPD is associated with significant morbidity. Patients frequently seek mental health service and are hospitalized. Difficult in thinking about others as having an inner world with feeling and conception different from one's own. It focuses on four main areas, which is identification and appropriate expression of affect, development of stable internal representation, and development of stable external representation, and the formation of stable external representation. Psychoanalysis is the treatment of ABPD, which is avoidant personality disorder, has no non-systematic case studies, effectiveness studies, or randomized control trials. The treatment was primarily based on psychodynamic principle, with some cognitive behavioral and interpersonal principle used in the third year of treatment. For the strength part is, nature of human development is one of the greatest strengths in psychoanalytic theory. They explain all aspects of mental functioning. They give opportunity to the patient to share their problem in a professional way. For example, the therapist applied the psychoanalytic theory toward Grace, and Grace can share her problem freely. Psychoanalysis can help people understand themselves by exploring their unrecognized impulse and they are hidden in the unconscious. In psychotherapy, people are able to feel safe as they are explore feelings, desire, memories, and stressors that can lead to the psychology difficult. And psychoanalytic theory or psychoanalysis was developed by Sigmund Freud as a means of developing an understanding of the inner working of the human mind. Many of the theories of personality development by psychodynamic thinkers such as Erikson, theories of psychosocial stage, and Freud psychosexual stage theory continue to influence their field today. And for the weakness and conclusion, I'll pass to my friend Wahida Mardiah.
Hi, my name is Norwaida Marda. I'm as a presenter number 2. So I will continue with the strength. Sorry. Okay, so for the weakness psychoanalytic theory. So main weakness of the theory is found to be its lack of an inherent instance of truth that shows the dreamer the way to be a better and more achievable lifestyle. So criticism of Freud's psychoanalytic theory, they state that the unconscious mind did not consist of hidden or repressed passionate emotion, and the primary weakness for this theory, Freud suggests that all thoughts, behaviors, and emotions are determined by our childhood experience and unconscious mental process. So this is a weakness because it suggests we have no conscious mind. Uh, this is suggests we have no conscious free will over our behavior. So psychoanalysis is an effective therapy for dealing with mental disorder, and has been proven to be effective. However, it is based on Freud's theory of the personality, which is fundamentally flawed in that it has no supporting research evidence, and psychoanalysis is limited as a therapy for a mental disorder. Psychodynamic therapies it can use for general anxiety disorder. It is a little help for the patient who has a BPD, which is borderline personality disorder, phobia, or OCD. It cannot be used for specific anxiety disorder. So I will continue with conclusion for the first article. First article is Conference Focus Psychotherapy, EFT, for Narcissistic Personality, engaging patients in their early treatment process. So, in the treatment process can readily devolve into a vicious downward cycle involving the patient's retrenchment into a paranoid, hostile, or stance, generating intense such as counter-transference pressure, and compromising the therapist on observe and analytic functions, and result is an premature termination of treatments. Based on psychoanalytic therapy, it is a form in depth talk therapy that aim to bring unconscious or deeply buried thoughts and feelings to the conscious mind, so that repressed experience and emotion, often from childhood, can be brought to the surface and examined. And narcissistic personality disorder involve a pattern of self-centered, arrogant thinking and behavior, a lack of empathy, such as grace. So the sign of the symptom that actually grace or narcissistic personality patient have is grandiose sense of self-importance. And actually, grandiosity is the defined characteristic of narcissism, and it more than just arrogant. Grandiosity is an unrealistic sense of superiority, and narcissistic also believe that they are better than everyone else and expect recognition as such, even when they have done nothing to earn it. Such as one already said about the Grace. Grace has a problem. She want to show their strength and life in a fantasy world that support their delusions of grandeur. Okay, so um, for the second article, if avoidant personality disorder and BPD, borderline personality disorder, are the two most frequently diagnosed in PD, which is personality disorder. In addition, mental difficulties and low effect consciousness is such as difficulty factor for psychopathology. PD is associated with a variety of emotional distress, high risk functional disorder, and significant treatment challenge. Studies show that APD and BPD can be associated with mental dysfunction and AC. So characteristic of APD patient, such as heavy feelings, fear of being ridiculed, hypersensitivity to negative evaluations, and have adequate patterns of social inhibitions. And BPD patient, it is to have a problem of lack of self stability, such as emotional anger and in relationship, intolerance, and to silence, and potential to destructive. And therapy used to patient with BPD is CBD, which is cognitive behavior therapy. CBT can help people with BPD identify and change their belief or their behavior that form the basis of inaccurate. So BPD may be related to PTSD, which means post-traumatic stress disorder, and often BPD is diagnosed to women, but men are also not spared from BPD pain. So I think that's all from us. Thank you.